is Michael Yates, and I'm your host. So glad that you took time to spend time with us. If you haven't already, please subscribe and ring the bell so that you get notification of each and every episode. Again, thank you for joining us. Back again, Kim Quartz, Director of the Mobile Health Clinic. So glad you're here with us today.
Thank you for having me.
So we were just talking this morning while we were setting up that the Mobile Health Clinic launched right after Memorial Day, sort of mid-June.
Yep, June 14th.
Of 23. So December 14th would have been 6 months.
Yes.
We're recording this in January, so we're probably a little bit at 7 months. Seemed like a nice time to check in, see how things were going.
Absolutely.
Yeah, so what's it like wheeling that 33-foot mobile health clinic around rural parts of East Tennessee?
It is an adventure every day.
I bet.
It is an adventure, and no 2 days are ever the same, whether it's because we're in a different location or just different issues arise. We have learned to kind of just roll with it. You just have to roll with it. Things are going to change, and you're just going to change with it.
Yes, yeah. No, that's well said. That's probably a good life philosophy. Just roll with it.
Just roll with it.
So we are 1 week post what people are calling Snowmageddon.
Yes.
So much of East Tennessee was blanketed in anywhere from 8 to 10 inches of snow. I suspect that kind of put a kink in getting the 33-foot RV out and about.
It did. It put a huge kink in it. We did not go out for 6 days straight.
Yeah.
It wasn't safe, and I'm pretty sure some of the roads that we would have taken wouldn't have even been able to be driven on at that time.
In some four-wheel drive vehicles, let alone a rear-wheel drive 33-foot.
Right.
Yeah.
Right.
So, okay, you mentioned locations. Let's remind our viewers where this is parked 5 days a week.
On Monday, we are in Scott County at the Oneida Walmart. Tuesday, we are in Campbell County at the Jacksboro Walmart. Wednesday, we are in James County and Fentress County in Jamestown at the Baptist Church.
Yep, First Baptist. Jamestown. Yep.
Thursday, we are in Union County at the Union County Courthouse in Maynardville. And Friday, we are in Morgan County and in Deer Lodge at the Morgan Scott Project.
All right, wonderful. And folks can actually get specifics and even be linked to the directions from their mobile phone by going to our website, where the Mobile Health Clinic, all the locations and times, phone number is all there.
Correct. And we have a direct line to us, so when you call us, the number, it will come straight to us.
Yeah, wonderful. We probably ought to take a moment just to thank and recognize the funding source of this this expansion of rural health accessibility, particularly integrated care in rural areas. Department of Mental Health and Substance Abuse Services.
Yes.
They are the funding stream that has allowed us to expand accessibility to populations of folks that otherwise may not be able to access the care, and certainly for those that don't have any form of insurance whatsoever.
Correct.
So I've had the good pleasure of meeting this crew, this mighty, fun, positive crew of folks. Tell us a little bit about who is on this unit.
Well, Leanne Beatty is our provider. She's a nurse practitioner, and she's dually certified. And she does all of the psychiatric medication management and primary care. We have 2 Sarahs, Sarah Moore and Sarah Garlington. Both are therapists. Sarah Moore is with us on Monday and Friday in Scott County and Morgan County. And Sarah Garlington is with us Tuesday, Wednesday, Thursday. We have Melody McMahon, who is our esteemed driver and our peer support. Madison Paul is our office coordinator, and our newest member is Mackenzie Zanoli. She is our care coordinator.
All right, it's quite a team. If you haven't had the pleasure of paying a site visit to the clinic when it's in your county, I encourage you to drop by and just say hello. I always enjoy my opportunities to do a movie review with Melody.
Yes.
Share, you watch this, don't watch this. It's like our own personal Goodreads, but for movies. So yeah.
Absolutely.
Yeah. It's a fun group of folks, and they're very passionate about what they do. If we were to look back in the rearview mirror, lessons learned, certainly I know comically a few lessons learned, like an awning that comes out in the
Yes.
wind that can pose a certain
That
maybe
doesn't roll back in?
the window shades that come down for the driver, but what other sort of real lessons learned other than, they can be comical, but other lessons as well?
Earlier when I said you have to roll with it, I also meant you have to roll with it when it comes to the mechanics. We have learned, we as in everybody on there, all sorts of stuff about mechanics, generators that we would have never thought I would ever learn. We've been troubleshooting garage door openings and generators not starting. You have to be ready and open to learn anything. And when you don't know, it's extremely important to say, hey, I don't know, and call Ed.
Yes. Ed is the lifeline.
Ed is our lifeline.
Thank you, Ed. Thank you. Those are, who knew when you went through all this academic training that you've received that actually you'd be learning more about generators, operating
Yes.
systems in a 33-foot RV, parking issues, weather-related challenges. So
Internet
connectivity.
Yes.
Well, you guys have had and kept a very positive attitude throughout all these little lessons learned. How about with the people? I've had the good fortune of being out at the clinic in various locations, and it's always, certainly there are some folks that are scheduled for routine, whether it's a primary care with Leanne or a therapy appointment, or some of the team heading out to go pick someone up to bring them because of the inclement weather.
Yes.
Tell me a little bit about that.
We have, in Campbell County, we have a gentleman who rides his bike 13 miles to his appointment with us. And one day he called and said, hey, I'm going to be there. I'm just running late. It was very cold and rainy. And that's when we found out he was riding his bicycle. So we told him to stop, go in wherever he was at, wherever he'd pulled over, and we picked him up. And we have since told him throughout the winter, we will pick him up, we will bring him and take him home. Somebody who's that dedicated to show up to therapy. Obviously he wants it and he's willing to put in the work, and we are too.
Yeah. Literally meeting people where they are.
Yes.
And that's a really cool aspect of what this unit and this team of people can do. That's wonderful. I know we're going to try to include more opportunities to share the good news around the work that's done through the mobile health clinic. We use this fancy word, integrated care, and I don't know that everyone really understands what that means. So how would you explain that to our viewers? What distinguishes this mobile clinic from other mobile clinics?
Well, we do integrated care, which is your primary care, your physical health, and your behavioral health. And Leanne can see people for both. So we get the whole picture. It's all integrated.
Yeah. So I don't have to just have a mental health issue to come to the unit.
Correct.
I don't have to just have a primary care issue to come to the unit. And if through the assessment process, it is determined that maybe I have some substance use conditions that need further treatment, is that accessible through?
Absolutely.
Okay.
Absolutely. And you don't necessarily even have to have an issue with primary care. If you need a physical. I mean, people have started, they've come to us, they need a physical for a new job, and then now they've just stayed as routine
Yeah.
primary care.
Yeah. And I think if folks are interested in knowing what does this actually look like and who are these people, we'll put the link in the content below, but there's a great little 45-second clip that's on our website. It's also on YouTube. I think our YouTube channel also has it. So you can actually meet some of the folks. You're the one that's actually welcoming people into the rig. Yes, yes. But that gives you, for a lot of folks are anxious about the unknown. And, nature abhors a vacuum. So if you can't visually see and know, oh, this is the actual RV and these are the people that are providing the care.
Yes.
Oh, okay, well, let's talk about that icky thing called how do I pay for this and insurance.
The great thing is, if you have insurance, we will bill your insurance. If you don't have insurance, we're still going to see you and provide services. We are funded by a grant. We will also assist with helping you apply for insurance for behavioral health safety net or TennCare if it is appropriate.
Yeah, and that's very important for folks to know. That can be a real barrier for people accessing attending this. So can I just show up anytime or do I have to call ahead?
You can show up anytime. I would recommend calling ahead. Certain days we are very booked, so it's easier to have an appointment because you're absolutely going to be seen. Some days we don't have any appointments, or we don't have any, so therefore you could walk
up.
I would recommend calling.
Okay.
And it might be, hey, can I see you? And I'm going to tell you to come in the next half hour.
All right.
So.
And we'll put that number also in the comment section. What are we missing to get out there? This is going to be here as the weather improves. There's more and more windows of opportunity. I think we're going to be doing a round of meetings here late winter, maybe early spring, about some locations that we selected with community advisory committees. Have been working out really well. Others, maybe we need to reconsider where the clinic is located to
Correct.
increase accessibility. Yeah. One of Ridgeview's top strategic initiatives is expanding accessibility to care. So certainly the mobile health clinic fits right in line with that initiative, and we're so pleased that it's aligned with that so that every outpatient clinic location, all staff working in those counties and others can be pulling in the same direction to advance that.
Yes.
Yeah.
And we also assist with the outpatient clinics. We can do intakes for them. If I know that everybody has same-day access open clinics, but we can also assist with that as well to get them in.
And let's be honest, some folks may have a reluctance to being in a lobby with a lot of people, or maybe there is a level of anonymity that they would like to have about not being in a traditional outpatient location.
Absolutely.
So a mobile clinic can actually afford you a way to mitigate those concerns as well. All right. Well, excellent. Good information. Good
Thank
update.
you.
Love it. Love it. Now, you ready to play the game?
I am ready.
You're ready.
I'm ready.
As our viewers know, we always like to close out our time with our guests with a little opportunity to get to know one another better. So I hope I've not asked you some of these before, and if I have, I hope you've forgotten them.
Yes.
And it'll all feel fresh and new. So let me put on my spectacles here. Okay. So Kim,
Yes.
and you can play along, whether you're in one of our PSR programs, peer support programs, or just tuning in. Think about some of these questions and how you might answer. If you could travel back in time, what advice would you give to your 18-year-old self? Now, I know that's probably just 5 years for you.
5 years ago, that's not very long.
She's thinking.
I am. I'm trying to make it sound very nice. Don't sweat the small stuff.
Don't sweat the small stuff.
Don't sweat the small
So,
stuff.
I used to have a coffee cup that actually said that, don't sweat the small stuff. And I think in a fit of being caught up in the small stuff, I threw it away. No, I don't know. But I used to have a coffee cup and a magnet. Good advice. All right. Are you an early bird or a night owl?
A night owl.
Really?
Yes.
So, like, how late?
It all depends.
So, are you in pain right now
Yes.
while we're doing this?
Yes.
Yeah. That's why.
I don't wake up until about 10 o'clock. I might be at work at 8, but I'm not really fully awake until 10.
Yeah, I got you. I know. Unfortunately, the older I get, I'm embarrassed to say what time I sometimes have to go to bed. Nighty night. What decade of music is best?
90s.
And you have an example? Oh, I think I asked you. Would you say
did?
Aerosmith or something?
Yeah, but I think that was more 80s, 90s.
Okay.
80s, 90s, if I could do 2 decades. Because a lot of it kind of flowed.
All right. Do you have a book that you would recommend? Like a favorite book?
No, I've been reading a series by Kay Hooper, and it's kind of like an FBI psychic series. Enjoying it, but
Okay.
not a specific book.
All right. So are these based on, is this fiction or is it, okay, all right. Yeah, I'm always amazed at, one of our colleagues also watches a lot of crime and
Yes.
that real life crime
Yes.
investigation stuff, and I'm always like, man, all right, whatever.
That's what relaxes us.
To thine own self be true. Would you rather always be 10 minutes late or always be 20 minutes early?
Oh. I would like to say I'd rather be 20 minutes early.
We all would, right?
Right, because I don't like being late, but that's a long time.
But you come in late and you're the star of the show.
You are.
Hey,
Everybody knows when you
Kim's
got
here.
there. Right.
That's right. Okay, one last question. If you could only watch one movie for the rest of your life, so we're talking like another 60 years.
Correct.
What would it be?
Top Gun.
Top Gun.
Top Gun.
The
first.
first one. Wow. Okay, I did not see that one coming. All right.
It brings out all the feels. It's a little sad at points, a lot of energy.
Is it also like, does it transport you back to a period of time when you
Yes.
watched it that's like, this is the,
It's the best movie ever.
Yeah. Okay, I got you. Days of Thunder. No, I'm
Yeah.
kidding. All right, is there anything else we need to get out there
No,
for our
I think
viewers?
that's it.
All right, Kim, thank you.
Thank you.
We'll do a 1-year update.
Perfect.
So that'll be middle of June of this year. So see you back here in about 5 months,
Okay.
thereabouts. Thank you all for tuning in. We always appreciate you spending time with us. Please don't forget to, if you like this discussion, like the video, please do subscribe and ring the bell. We'll see you next time. Take good care. Bye-bye.